Hey guys, welcome back to Wellness with Delaney. Today I have Dr. Jackie Roelofs, or you might know her as Dr. Juicy Jackie. She is a pelvic floor PT. I have been looking for the perfect pelvic floor expert to bring on this show, especially for the women, for months. Okay, I have been so fascinated by this topic. So I hope you enjoy this episode as much as I know I'm going to. I cannot wait to learn about all things pelvic floor and how we can be healthier and really take care of our bodies at a really holistic level, whether you are just a woman in fitness or you're pregnant, postpartum, or any other stage in life. Like, there are so many resources for you right here. Dr. Jackie, thank you so much for joining.
Yeah, I'm so glad to be here. Thanks so much for having me.
I can't wait. Okay, so let's just start. Like, can you radicalize me on why women need pelvic floor PT?
Oh my gosh. I'm gonna have to cut myself off, but um, I'm kind of on this thing where from an advocacy standpoint, I think that women should have a pelvic floor PT in their back pocket, just like they have an OB in their back pocket. For any kind of pain issue, women's health issue. I think that every woman, especially, as you're entering in your childbearing years, but like honestly, ongoing into perimenopause and menopause, there's so many hormonal changes that impact the pelvic floor. There's so many things that we just, obviously are not taught about ourselves. And to be honest, it's like, OBGYNs, like they have to learn how to do surgery. They don't know how to assess pelvic floor muscle function and how the body moves and how it interacts with the rest of the body. And so that's kind of my expertise. That's my whole thing, is that women should have pelvic floor PT at some point. I love it when they find me in the preconception, pregnancy, postpartum era, but it's never too soon or too late to start.
Okay, I love this because I do feel like there's this PT for pelvic floor has gotten more popular just from what I've seen, but I still feel like there is a little bit of this mentality of like it's something you do postpartum, right? And
Yeah.
I I don't know, I feel like we aren't even realizing what a resource it is. I wish I had realized it earlier on, because I just recently got on the train of like, oh my gosh, this is so important. So, what are some signs and symptoms that a woman should maybe explore working with a pelvic floor PT when it comes to their own health?
Leaking for sure. Lots of people leaking when they sneeze. And I think people are surprised to find that that's actually pretty common even in younger folks or people who have not had babies yet. I actually just saw a 20-year-old college student who was seeing me for other reasons, but she's like, I asked her about leaking. She's like, oh yeah, I've had that my whole life. And I was like, okay, so leaking when you cough or sneeze, even if it's just a little bit, it is your body telling you that something's going on. I'm a big advocate for severe period pain, period cramps. Pelvic floor PT can help with that. Painful intercourse. And also, I think a lot of people don't realize that pelvic floor PTs, we are physical therapists. So when a lot of people think of physical therapy, they think like, oh, that's where you go. Like if you sprain your ankle or you have surgery, for back pain, hip pain, a lot of old people go to PT. So we can treat your back and hip pain, but what's so cool about pelvic floor is that we can understand this other piece of your musculoskeletal system that gives us so much information about how your hip and low back are functioning. So I love to treat low back pain, hip pain. And then usually if I ask a few more questions, I find out like, oh yeah, and you're leaking too. Oh yeah, and you're postpartum, or you have prolapse, or you have diastasis as well, because the core function tells us about everything. So I'm trying to think any other specific. So yeah, like heaviness. A big one is constipation and bowel issues. Endometriosis, IBS, like honestly, just anything that's involved with, I say like the pelvic region is anywhere below your belly button to just under your hips. So anything involved in that for sure.
Wow. Could something like sciatica be impacted by pelvic floor?
Yes. Yeah. So sciatica is also kind of like a generic term where a lot of times people come in like sciatica, like you've got that sort of lower back right by your hip pain. And sometimes that's actually your pelvis being a little bit out of alignment. Sometimes it is a nerve problem. Sometimes it's a muscle imbalance problem. And sometimes it's all of those things. So my job is to sort of do the detective work to figure out like what's at the root of all of that and how can we change the way that you're moving and carrying and posturing your body in the day-to-day when you're not seeing me so that this won't keep just coming back. So
Yeah. Amazing. I love that I mean, it really is for all stages of life. And I don't think that's something that enough women know. And I'm sure there's a time maybe for men too, but like speaking to the women here, I know that we have a lot of, a lot going on down there
Yes,
that,
so much, so much. And we, definitely like trauma is related, like
yeah,
stress is related. So our pelvis and pelvic floor tends to hold a lot of that. And I know it sounds kind of woo-woo to say it. I know this is a wellness podcast, so like I'm sure that people are on board with that, but it also is neuroscience, like that, like the pelvic floor and then the brain are so, I mean, I guess your brain is connected with the whole body, but like your pelvic floor and your nervous system are so intimately connected, and it plays a huge role in like autonomic nervous system function. So I think that's a really interesting piece that we can, I use with my patients to kind of tease out why is your pelvic floor so tight all the time,
yeah.
usually
No, yeah.
somewhat related to the nervous system for sure.
Yeah, and I don't think that's woo-woo at all. I mean, my sister has a degree in like somatic trauma. That's probably not exactly what you call it, but
Yes,
essentially yeah, so like kind of how you use the body, right, to address trauma. And I think it's really interesting too, because I've been obviously just being in the season of life I'm in, really studying like birth and labor and everything. And I learned about sphincter law, right? Like how important it is to be at a good place mentally so that your sphincters in your like pelvic floor
yeah,
can relax. So I'm like, no, it's so connected. And
totally.
I think people see their mental health as something completely different from their like physiology. And it's like so crazy how the body is actually truly
So
connected.
yeah, so connected.
Yeah. So then kind of on that, do you see typically, and maybe it's both, but do you see typically people who are like too tight in their pelvic floor, or people who are too loose and mobile in their pelvic floor?
This is such a good question, because I think there's a really big misconception that like most pelvic floor issues are because your pelvic floor is weak.
Mm-hmm.
I love that more people are thinking about the pelvic floor and talking about it online, but there's just such a misconception that like weakness is what causes all these things. And to some degree that's true, but it's like the weakness is actually often at least in the population I see, like women in their 20s, 30s, and 40s for the most part. Sometimes I see people who are a little bit older, a little bit younger, but that's kind of the general population that I see. Most people's issues are coming from having an overly tight pelvic floor. Overactive or hypertonic is really the best word for it. It's like, we all have to have a certain amount of muscle tone or else our insides would fall out. There is a resting tone that the body needs the pelvic floor to be in. But yeah, having an overly tight pelvic floor, and what I would also say is an uncoordinated pelvic floor. So like it's not able to contract in the right timing because it's so tight and doesn't know how to relax.
That makes a lot of sense. Yeah, I've been learning because I always thought it was like, especially growing up, I grew up in like the ballet world, the dance world. So it was like, tighten your pelvic floor, tighten your pelvic floor. Like they would teach you to do Kegels while you peed, right? And I had to unlearn that, like just like literally to be like, okay, I'm gonna let myself pee and pee fully without like clenching and stopping, right? That sounds so TMI, but I used to like literally peeing like several times, clench and stop.
Yeah, that's crazy. It's so funny that they taught you that in ballet, but I'm not surprised by that. I had a little bit of a background in dance before I got into the sports world, but I see a lot of ex-dancers. Like it's a big population that tends to have pelvic floor issues, and I don't know. I'm sure one reason why, but there's a lot of other reasons why dancers tend to have more pelvic floor hypertonicity. But yeah, that's so interesting.
Yeah, it's so weird. I like realized it's honestly like in pregnancy that I needed to work on that. Like I haven't danced in 10 years, and I realized I was like, oh my gosh, I'm still holding on to this. So this is kind of a random question that just popped into my head from this. Are you then not a fan of those like weighted Kegels that people do?
I am not really. There are a few people that I might prescribe them for, but it's a very like, yeah, that's a nuanced conversation. The only person I have ever given them to as like a home exercise is when I was working in like a private practice, but like kind of a standard PT clinic, like corporate clinic, like not in my private practice. So I was seeing a lot of Medicare and older women. And so I sometimes had women that like, they were more on the under activity. They literally like could not connect with their pelvic floor. They were really just like squeezing their butt or their inner thighs instead of squeezing their pelvic floor. And so I would give them those more as a sensory input exercise because they needed the tactile cueing to be able to even do a Kegel. So that's like the only time I've ever used those.
Okay, that makes so much sense. I, for a long time, was like, do I need to get those? But it sounds like maybe not. So then also, okay, so obviously, like we've discussed, I have, a lot of women in my audience who are specifically trying to conceive, pregnant, postpartum. And specifically, like at the time we're filming this, tomorrow I'm 33 weeks pregnant. My midwife told me at 34 weeks, time to decondition because I've been lifting. And I have been seeing a lot of and I want to be careful when I say this because I do want to approach this with sensitivity because I don't know the reasons for everyone's different interventions in birth, and it could be related or unrelated. But I have been seeing and hearing of a lot of women, specifically in the fitness space, with this emergency C-sections. And I don't know specifically what's connected, what's not, but I have heard that sometimes being too strong can increase that risk, right? And not deconditioning. So for someone like me or the other women who are in a similar stage as me, how do you recommend preparing for birth, like deloading your pelvic floor, if that's something you recommend? Like, walk me through kind of that process.
But let's just maybe start with birth and work backwards.
Yeah.
With birth, we need a pelvic floor that is able to lengthen. So like I was talking about, the hypertonic pelvic floors are usually going to have a harder time letting go and lengthening. Now we have to be very clear that your pelvic floor will physiologically lengthen. Like it's meant to do that. But if we are working against it actively, it can be problematic. So, and it honestly just makes labor harder and more painful and, honestly longer. So, and I would say after my first birth, as someone who strength trained like my whole pregnancy, and I was like very big on like exercising my whole pregnancy, I wish that I would have spent more time on like pelvic floor lengthening and mobility exercises, but I'll get to that in a second. So basically, like to start with birth, like that's what we need is the ability to voluntarily let go of our pelvic floor. And for many women, like I said, in my office, I see so many women that have no idea how much they are clenching their pelvic floors all the time. And it starts with, like locking the knees out and butt clenching. So there's like a lot that's involved in that. And, I always tell people, I'm drawing a map in my head of all the different things that are contributing to your symptoms here. Some of it is true, like musculoskeletal stuff, like joint hypermobility. When you're pregnant, you're more hypermobile. So we tend to lock our knees out and swing our hips forward and arch our backs. And so that leads to pelvic floor overactivity. But then we've got the nervous system. So like stress and trauma and all of that can definitely show up in birth as well. So I always recommend like, let's work some of that out, before we head into birth, if possible. It doesn't have to be totally healed to have a great birth, but just kind of being aware that that can be there. So working backwards, there's differing opinions on this, and I have disagreed in the past with like both chiropractors and midwives of my patients on this. I don't necessarily think that you need to stop weightlifting or strength training in the third trimester, but add in more pelvic floor relaxation and mobility exercises. So in the third trimester, we want to be working on what I kind of say is like making space for the baby. So obviously we need the pelvic floor to lengthen as you are like, allowing baby to move down in the pelvis, pushing a baby out. But then we also need baby to be in an ideal position. We don't need that, but it's nice when that happens. I say that. I mean, I could tell you my whole first birth story. I had an OP baby who was 9 pounds. So he was in a funky position, and I gave birth to him vaginally without an epidural, but
Godspeed.
it was a journey. And I think there was a lot that went into that. I think had I done, had a different provider, had I worked on some of the mental pieces a bit more and worked on relaxing my pelvic floor more, maybe that would have gone differently. But, we all have our experiences that we learn from. And now I use that a lot in my patient care. But where was I? So baby positioning. Ideally, we would get that baby in a really nice position to be able to descend into the different levels of the pelvis and to be able to kind of spin in the direction so that their head can kind of come out the way that we want it to, in a way that fits the pelvis the best. So it's not about, is your baby too big? It's much more about, is there space for baby to move freely? And so in the third trimester, I'm kind of giving people, I've had this reel go viral a few times, like a birth prep routine of like, this is not, it's not about how big your baby is. It's about making space. So doing some hip mobility exercises, pelvic mobility exercises, getting those ligaments and joints a little more like, I mean, again, I say this, like your hormones are doing that for you, to be very clear. Like some of that will happen. Like if we were all just completely relaxed, like everything would happen how it's supposed to. Mm-hmm. But most of us do need to relax a little bit because we're really high strung, like high performing women that want to do everything right. And so that lends itself towards pelvic floor overactivity. It lends itself towards like butt clenching and ab clenching. And so I like to give my patients more mobility stuff to do in the third trimester while still maintaining what you can, you know, comfortably maintain of stability and strength training, because you need that to be comfortable, you know, so that you can pain and also prepare for postpartum. So as a long-winded answer, I don't know if I got to everything that you were looking for, but
yeah, no, that makes sense. It's more about like what you're adding in, I guess, and taking out. Do you think, is there a case for like lightening the load and like going a little lighter later in the third trimester when it comes to weightlifting?
Yeah, I mean, and this is such an individualized question. Yeah. So the research doesn't show any reason that like women should stop I mean, especially if they're already lifting heavy, there's no reason for them to stop lifting heavy. Like from a medical standpoint, there's a really great pelvic health researcher. There's a couple of really good ones. So we're getting more research put out on this kind of stuff, but most of it's coming out as like, yeah, it's kind of what we thought. Like there's mostly benefits to continuing to exercise at a higher intensity if you're able to, and if you're comfortable doing so. But I would say this is where, you know, if I see my CrossFitters in here or my people who are, I mean, I don't see that many people who are still running in the third trimester, but if they're running, lifting heavy, I usually am trying to do some internal pelvic floor release with them or teaching them how to do it if they're a virtual client, because it's just a good idea to get comfortable with like one, like knowing what your muscles feel like when they're tensed versus relaxed, and being able to see that you can actually breathe and change how that tissue feels. Because that's kind of the most important thing in labor, is that you stay connected to what your body and your pelvic floor are doing.
That makes total sense. And I've noticed, because I'm like really heavy into lifting, but I've also noticed just like in general, as I get bigger and get more tired, my body's telling me when to go lighter. And I feel like also like if you're listening to your body, because I do know women who are so attached to the idea of like perfectionism that like they would, you know, run themselves into the ground. And it was interesting, like second trimester, I had this like burst of strength. Like I was lifting my pre-pregnancy weight, like back squatting, like heavy. But then, as time goes on, I'm like, okay, like I feel more tired. I'm just going to go lighter. And I'm just focusing on like endurance, I guess. So I'm curious, because then when you talk about like the internal release, are you talking about like perineal massage?
That's a great question. I'm so glad you asked. Gosh, you said something that made me think of, oh my gosh. Okay. Well, that's going to come back to me, but I was like, I want to comment more like philosophically, like with regard to pregnancy and birth and all of that. But to just 100% agree with you, you're with so many things in pregnancy. It's like, we're asking all these questions, we're Googling all these things. And like most of the time your body is going to tell you, it will tell you when you need to stop sleeping on your back. Your body will tell you when it's time to like lift a little bit lighter, just because that's how much energy you have. It's not dangerous for you or the baby, but third trimester is hard on the body. So, so you asked me perineal massage versus internal pelvic floor release. So a little bit of a controversial topic, which I love.
I love that.
So I usually don't actually recommend perineal massage, although there is just, educationally, the research is like for first-time mothers. There is some good research to back up doing perineal massage in the last, I can't remember if it's 6 weeks of pregnancy. Yeah, so like at 34 weeks, starting at 34 weeks. Somebody might correct me on this. It's either 34 or 36 weeks. I'm pretty sure it's 34. But doing perineal massage can reduce the risk of a degree 3 or 4 tear. So those are your obstetric anal sphincter injuries, which are not fun. They are treatable, but I mean, gosh, tearing is actually a whole other thing I could rant about. So I'm gonna like cut myself short of that, but we can definitely talk about that too.
I love that.
Long story short, I really think that tearing, especially like 1 or 2, a grade 1 or 2 tear, is fairly normal. And there's so many things that go into it. There's a lot of like influencers who's like, I did this and I didn't tear at all. And I think that makes people feel like they failed, just like another thing that you're not doing right. So
Yeah.
that's just, I'm going to cut myself off there. But with regard to perineal massage, there is some good evidence to support prevention of a severe tear, which is a grade 3 or 4 tear, which is tearing into the anal sphincter muscles, which sounds as bad as it. Yeah. It feels as bad as it sounds.
Yeah.
Thankfully, I've not had one. But I will say this from a personal experience, because, you know, when I was doing my first birth, it was like, you know, I was doing pelvic floor PT, but I'd never experienced pregnancy and birth myself. So I did, you know, what I thought of as like all the right things. Strength trained through my pregnancy. I didn't do a lot of pelvic floor relaxation, which I should have done. I would go back and do that. But I do think all of the exercising that I did my whole pregnancy really allowed me the strength and endurance that I needed to finish my really hard labor. I mean, it was 54 hours, you know, unmedicated, and like I was medically safe and baby was medically safe that whole time. It was just a really long, hard labor. And baby was in a funky position and he was big. So it was just, it was tough. But I do think the way it felt when I was crowning, I was like, I really am glad that I did perineal massage, because I do think that, you know, in that moment, I was like, oh my gosh, I'm having a grade 3 tear. Like I had a feeling, I was like, it's gotta be a grade 3 tear. And it was just like a little, you know, maybe a 1 or a 2, but not beyond that. And so I'm really grateful for that. So, so I'm playing devil's advocate, because on the one hand, I don't necessarily like recommend it for everyone, because getting back to my initial thought, this is how my brain works, by the way. I go in circles a lot, but
love it.
Coming back, I really think most women need to focus more on relaxing the pelvic floor, and like some manual release can really help with that. And I would say, to be more specific, desensitizing the pelvic floor. So perineal massage is one way to do that, but I think it's a little bit more aggressive. Like I said, if we get out of our own way, the pelvic floor will do what it's supposed to do. You know, it will stretch to fit baby. Like it knows, our bodies know what to do, but a lot of it is us getting in our own way, or the system kind of getting in our way. And so what I usually recommend is doing some manual muscle release with, you know, like a thumb or a pelvic wand, or, you know, definitely ideal if you can get in and see a pelvic floor PT. But yeah, that's what I teach my patients to do is if they're like a virtual client, I'll like teach them how to do that themselves, because I think it's more important that they can relax their pelvic floor, which helps to relax your nervous system, right? Than it is to just stretch the heck out of the perineum. So.
Yeah, that makes a lot of sense. Yeah, no, that totally makes sense. And then is there validity to, I've heard a lot of people saying like, if you like loose lips, loose hips, loose jaw, like loose pelvic floor, like kind of relaxing your face to relax down there for birth. Is that valid?
So one of the ways I've heard this said, that's like my favorite that I always remember, is this doula from, oh my gosh, she's from Great Britain, and she is, gosh, what is she on Instagram? I can't remember. I'll have to find her information, but her thing is floppy face, floppy fanny.
I love it.
And British English fanny is vagina. So floppy face, floppy fanny is how I think of that. But I do think that, so there's a huge connection with our jaw and our pelvic floor. Like I said, had a 20-year-old in here earlier who has like a super, super tight pelvic floor, having a lot of pelvic pain. And I just asked her a few more questions and was like, sure enough, yep, you've got jaw pain and neck pain too. So a lot of us who are people who clench I mean, there's just kind of patterns that I see. So it can really help to relax the jaw. They share a connection from like a nervous system standpoint, but gosh, there's like so many ways to relax and birth. So I kind of like encourage people, like, don't overthink it. Just find what works for you. Another one that I really like is to like relax your toes, because those do also share sort of like a nerve root with the pelvic floor muscles. And so if you can like relax your toes and count backwards from 10, that's like my favorite labor tip, at least for early labor. I feel like that worked well for me and for my clients. But yeah, so I mean, if you think about it, relaxing your jaw is just kind of like really letting your whole body go. And so if you can relax your jaw, you can let your body be heavy, you can let your pelvic floor relax.
As we're saying this, I'm like thinking about relaxing my jaw, like trying to feel it. No, and it's so true, because I feel like you're also like taking your mind off of like what's going on, right? When you're like focusing on relaxing a different part of your body, like it's kind of distraction too, like in a good way. I don't know, maybe I'm off base here, but I feel like thinking about relaxing a different part of my body, I'm not going to be hopefully thinking about the contraction as much and like getting, freaking out over that.
Yes, exactly. That's kind of like what, like, take something like away from like your uterus in your mind can definitely help. But I mean, I definitely notice this when I am like super stressed and clenching my jaw a lot, or I mean, if you just clench your jaw, like I feel my abs come on, which also kind of pulls on your pelvic floor. So there is something to that. I wouldn't say like scientifically in the research we have like an abundance of evidence, but I think that there really is something to that for sure.
Yeah, no, absolutely. And I love I don't know if you've seen it, but there's like the post that'll be like, cite your sources. It's like, my source is feminine intuition. And I love that because I'm so into like the midwifery care model and all that. And I feel like so much of it is literally just like lore and intuition and passing things down word of mouth. And oftentimes then when they do like this, figure out the science does align. So I love that. So, and then I don't want you to give away, like, don't give away the juice for free, and I know this doesn't replace seeing you as an actual PT, but for women who are preparing, let's say you're in they're in their later second or in their third trimester, what are some quick exercises that you recommend them incorporating into their workout regimen for relaxing and mobilizing the pelvic floor?
Yeah, I have like a really good little circuit on my Instagram and on my YouTube channel. I have like it's like a private unlisted YouTube channel that I use for my clients, but I have a couple of playlists that I send. So if anybody wants to DM me on Instagram Mobility, I will send them the whole playlist of some of the things that I really like. But yeah, I mean, definitely if you have a birth ball, getting on the birth ball and doing some just circles and figure eights and moving your hips from side to side. And I mean, I definitely say like first things first, like just move into your hips and see what feels good to you, because that is part of birth, is connecting with your body and seeing what you need. But yeah, so doing some deep squats with some rotation. I love, so also on my Instagram, like I said, there's a little routine that I like to give my patients. It's also on my blog. It is using a yoga block. And so you can like put your knee on a yoga block, but do basic things like a cat cow, but with one side of your pelvis elevated, and then switch sides. And honestly, I always tell people, I'm like, look, it's not just birth prep. It actually feels really good in the third trimester, especially as you're getting a little more uncomfortable. So those kinds of things, hip hinges, like rock backs, and then inversions where you're, not everyone can tolerate it. Just sometimes they get lightheaded, but getting up on like a bench or a chair or a couch and then putting your forearms down on the ground and just kind of letting your belly hang feels so good, but it can help baby get to a better position.
I love that. Yeah. Cause, my girlie's been right in my pelvis since like 20 weeks. And there have definitely been days where she's wedged. Those inversions and sitting on a ball. I'm actually sitting on a ball right now, but they've saved my life. Like literally there were days where I'm like, I cannot stop feeling like I have the like emergency need to pee, like just pressing. And oh my gosh, like a deep squat and inversion has saved my life and my mental sanity.
Yeah, it's so good. And I love doing like a supported deep squat too, like just like sitting on a yoga block. So you can do like the highest, like yoga block is a great tool, by the way. Everyone should have one in pregnancy, because there's so many things you can do with it, but like a supported deep squat is so nice where it's like, you know, if you're not feeling like holding that position, like you could just get in there and then breathe, and you can actually feel that sensory input into your pelvic floor. So it's a good way to practice relaxing into your pelvic floor too.
Oh, amazing. I'm definitely gonna have to try that out. Yeah, because I'm definitely working on all of that right now.
Mhm.
But okay, so and then moving into like the postpartum, here's something that I feel like is confusing to everyone. So on one end of the spectrum, and maybe there's truth to everything, and I'm sure you have like your own protocol, which is what I'm really curious about. But like on one end of the spectrum, it's like, okay, first 40 days, you need to be in bed, rest, recover, da, da, da. And then there's the people who are like, 2 days after birth, I was going for a 5 mile walk and I was lifting weights 4 weeks after. And then they're like, and then, you know, there's all this gray area in the middle.
Yes.
And maybe I'm sure there's a level, like probably there differs between individual clients. And I feel like I keep prefacing that because no conversation somebody listens to is going to replace actually seeing somebody with individualized care, right? But in general, walk me through like what would it actually look like to have a postpartum recovery window that's focused on healing, that's getting back to moving, like finding that balance.
Yes. And this is like one of the ways where I'm like, I feel like my opinions are radical in both directions because, and you know, Instagram is just not the place for nuance. So it's always hard to like communicate. You know, you have to say something that's like so extreme and so bold for the algorithm to pick it up. But really, you know, the two things that I recommend is radical rest and radical like movement in early postpartum. So I'm going to unpack that. I mean, I really love the postpartum 5-5-5 rule, which I don't know, in midwifery care world, I feel like people are familiar with that. But I mean, I just break it down as like, you're basically going to be in bed for a week, like not getting up except to use the bathroom and to shower. And you're just bonding with your baby, hanging out, getting the hang of breastfeeding and letting people wait on you hand and foot. And then week 2, you know, you're still mostly staying in the house. Like you're really not, I mean, I would say like, you know, this sounds radical to people, but like you're not leaving the house. Like you might step outside for a minute, but you're not really even going on like walks. Maybe you walk to the mailbox and back, but you're still mostly resting. So that's kind of my, I mean, and a lot of people are like, that sounds insane. I could never do that. And the reality is, you know, like some moms have babies that are in the NICU. They don't get the chance to do that. They, you know, people who have like other kids and they don't have the support that they need at home, or their husband is not able to take off work. So I can also say, like, I know that like realistically that's not possible for everyone, but how can you have a mindset of radical rest and get horizontal as much as humanly possible? I cannot tell you the difference it made for me in my recovery, my second birth. The first birth, like I told you already, it was like a horrible, I say horrible. It was a great birth. It was really, really hard and traumatic in many ways. But then my early postpartum experience, that's a whole other story. But one piece of advice I can give is don't have your in-laws all be at your house for Thanksgiving within 2 days of a traumatic birth. But that's a story for another day. But basically, you know, I wasn't really resting in the way that I needed to. No one had told me that's what I was supposed to do. And, you know, I wasn't like trying to exercise, but I just, honestly, I remember like getting up and trying to just walk from one side of my house to the other and feeling so heavy and like I could barely breathe. And you know, it's like a sign to lay down. So I feel like in my second postpartum, that was just like a big lesson for me of like seeing like the beauty and like allowing myself the permission to rest. Even though I also had a toddler at the time, and I was just very clear from the beginning of like, I'm not getting out of bed. So radical rest, number 1 for the first 2 weeks. And I recommend starting postpartum rehab day 1. So when we talk about sports injuries or surgeries from sports injuries, like I'm a physical therapist who has treated a lot of sports injuries, and we never tell people to just wait 6 weeks and like do nothing. And then you're like back to your sport. That's not
go back to a soccer game, go back to the gym.
Yeah. And when you think about how much your vagina stretches in a vaginal birth or having a major abdominal surgery, if you have a C-section, like we just are telling women, like giving women no guidance on what to do in those first 6 weeks. Like that's insane. And then suddenly you're allowed to go back to CrossFit. Okay. Like
That is crazy.
It's crazy. And it's not good for women, and it's not a good idea to go for a run at 6 weeks postpartum if you haven't done any foundational work to heal your muscles. So my big thing that I harp on, and I actually just launched my first like digital program, so can share this with your audience, but I started a like 0 to 6 week postpartum program that is designed for the first 6 weeks, safe for C-section, safe for vaginal delivery. And it's based on the principle of radical rest in the beginning, while also exercises you can do in bed the first 2 weeks. Breathing exercises, mobility exercises to help your body just kind of have better blood flow, reconnect to your muscles, coordinate those muscles. And then once you've built that, around like week 2 to 3, you can start introducing some gentle core activation exercises. And then from there, if you're mastering those, we can make the core activation exercises harder. Like that's how rehab works in the sports world. That's how surgery rehab works, is we give the muscles just enough input that they can adapt while also allowing them to recover and do their healing thing that your body already knows how to do. So, I mean, that's kind of, there's a lot of nuance to that, right? So the research says, like early onset of postpartum exercise is really good for mitigating postpartum depression. It's safe to exercise early postpartum, but we also have to be honest that postpartum variables are so different for everyone. And I'm like my youngest is 19 months now, and I feel like I'm kind of just now getting out of like my body feeling so postpartum. And even still some days I'm like, oh, like, man, I'm going on runs now, but like I'm still just sore. There's like ickiness that makes me feel like I just had a baby, So, and I did like less than 2 years ago. That's like you're barely unpregnant, when you're in those early days. So I think we need to be honest that the level of support you have, do you have the ability to spend time taking care of yourself? And how much sleep are you getting? Because all of those things factor into recovery, breastfeeding, hormones, all of that. So there might be some people, and I think that's the hard thing about postpartum from a mental perspective, is you see people out there like doing their thing. They're like 3 months postpartum and they're running a half marathon. It's like, honestly, I wouldn't want to be that person, because I'm like, that's probably not great for their pelvic floor in the long run. But who knows? There's plenty of people who do the rehab the right way, and they are, they have the means and the resources to do that, and they feel great. So, I'm not going to judge that, but,
Yeah. No, definitely send me the link to your program. I'll put that in the show notes. I personally definitely want to check that out, because trying to build it, I'm such a planner. I'm like, what's my plan of attack, right? Like I love to be prepared. So I think that would be a really great resource for myself, but also
try to get it out there in the world a little more. I'm like, I just kind of did the soft launch last month, because I was like, like I just need to, I've been saying that I'm going to get this out in the world. It's been created for like months. And I was like, just send the email, Jackie, like just send the email. So it's out there in the world, and now it's, it's accessible. And, I'm trying to build on that to be like, okay, this is the first 6 weeks and this is the next 6 weeks. And then like, okay, like, you choose your own adventure from there. Like I want to get back to running. I want to get back to heavy lifting, things like that. So that's the plan. But, I just felt like there's so few resources that really give you, what do you do like in the first week?
Yeah.
And even if you're not ready to do anything, or your mental space is just so overloaded, it's like, well, you can start this week 2 or week 3. It's a great place to start either way,
Yeah, and I feel like anyone can do a breathing exercise. Like we have to breathe anyways, right? Like might as well bring your pelvic floor into it. That's my philosophy.
I have this reel that like, I keep kind of posting a different version of like, oh, it's crazy to think we're telling women like not to do anything when these exercises are safe from day one. And it's literally me demonstrating like diaphragmatic breathing and like a couple of mobility exercises, and most people are like very on board with that. But there's like a few comments I get that they're like, well, women should not be doing this kind of thing. Like early postpartum, you have like a plate-sized wound on your uterus. I'm like, did you look at the video? Like it's actually mostly breathing exercises. And the whole point is like, but they're like, it's totally fine if you don't want to do any of these things, but there are women who are Googling, what can you do? Or like, maybe they had a traumatic unplanned C-section and they're looking for what they can do safely. And all they've been told is to just not lift more than 10 pounds for 6 weeks. And that's it. Like, they need those resources. So that's my big spiel that I will not shut up about. So
I love that. Well, I love it because it's like constantly we're telling women what they can't do, and they're like, okay, well, what can I do? And that's like, I'm a what can I do person. I'm like, I just want to know what's okay. Okay, so then, what is diastasis? I don't know. I can never say that. Diastasis recti, and how do women prevent or recover from it?
Okay, so diastasis recti is the separation of your abdominal muscles. So we have this line in the middle of our abdominal muscles that all four layers of our abdominals connect to, called the linea alba. So when we're pregnant, that linea alba has to stretch to make room for the baby to grow and all the other things that grow with that. So, there's some research that shows, I can't remember the percentage, so I'm like gonna get this way off, but it's like over 70% basically of women by the third trimester, like a certain week of pregnancy, 36 or 37, something like that, have a diastasis. Like, that has to happen to make space for, it's a natural process. So I'm really big on like demystifying the things that sound so scary,
Yeah.
But then after birth, for some women that resolves on its own within a few months, and for other women it does not. So clinically speaking, 3 fingers or more wide is a clinically significant diastasis. But for a lot of other women, it's like, you might have a 1 finger or 2 finger width, but it's a little bit deeper. And so the most important thing is that we're able to create tension across that gap to create, honestly, just good stability for the spine and the pelvis. And so for me, when I'm assessing a patient, it's like, it's definitely significant if I'm seeing a 3 finger width diastasis. That's not actually as common as you would think. I think people are very scared of that. And they're like, oh, like, this is going to give me a mom pooch, whatever. Well, the bigger problem is actually like pressure management. So that's something I usually, that's why I start with breathing with everyone. And so, I would say like diastasis for most people is not that big of a deal, but it is not irreparable regardless. And I think it's just mostly important that you're learning how to activate your core from the beginning in a way that's healthy and supports your whole like system.
Yeah. So would that be like things like hugging the baby? I see that a lot.
So yeah, there's a lot of cues that I don't love. Hugging the baby is pretty good.
Okay.
But it depends, I'm always like thinking about like, how is someone accomplishing this? So actually one of my favorite things, and I need to post, this is like a whole thing of mine. So like, draw a belly button to your spine or just brace is like, I have less of a problem with brace, but there's other problems with that. But drawing your belly button to your spine, I think most women are actually just sucking in, which is not helpful for the pelvic floor or for diastasis. It usually ends up making you have like overactive upper abs and underactive lower abs, which are, obviously very important, but it's also important for that balance of pressure in your abdomen. So we're not getting things like prolapse or like an exacerbation of the diastasis or things like back pain. So I like to tell people, like, start with just breathing, like taking a big deep breath in, try to breathe into your back and into your rib cage and into your belly and into your pelvic floor as if it's a balloon that you're inflating from the inside out. And then like use your breath to say shh or like an F sound. And just see what happens if you take that to the bottom of your breath, if you're palpating your belly. Usually you will see your belly button kind of rise up and your lower abs will be coming on. But that's a generalization because a lot of us have dysfunctional movement and breathing strategies that we've used for our whole lives. So, but yeah, hugging the baby it's fine. It's just maybe not comprehensive for everyone. It's, different cues work for different people. So
yeah. Okay, perfect. I definitely, yeah, I want to check out all your content on this, and I definitely want to encourage everyone else to
This is actually
head
giving
to
me
your page.
so many content ideas. This is
Yay!
some of these questions that you're asking me because I'm like, I never know like what people want to know. So
Well, this is what I want to know. So, okay, so I want to be really careful with time because I know you have to go in just a few minutes, but
yeah.
I did want to touch on really quickly. There was a post you had done about women. So this is not even pertaining to pregnancy. I promised I wouldn't leave you guys hanging if you're not in the pregnancy journey. Women just in fitness and how common prolapse is. What is the deal with that?
Yeah. Okay. So prolapse is a passion topic of mine because I dealt with prolapse after I say I dealt with prolapse. I have prolapse, but kind of discovering that I had prolapse after my first birth was pretty traumatic for me and took, it's like such a mental thing. And like, I really think that it impacted a lot of my mental health recovering from that. But so prolapse is a really scary word that's not as scary as it seems, kind of like diastasis. It is literally the vaginal wall. So if we're talking about, the prolapse that's most common after childbirth, it is the vaginal walls essentially kind of sinking in. And so when you say you have bladder prolapse, it sounds like, oh my gosh, my bladder is like sticking out of my body or it's falling out of my body. And in the early days postpartum, it can feel like that. Or, if you're dealing with that, I actually see a lot of people who have like chronic constipation, who are straining a lot. So it can be like a weightlifting thing if they're doing a lot of like Valsalva maneuvers, which again, Valsalva is not always bad. But it's like, how are we managing the pressure? And is it always going downward so intensely? Gosh, I'm like getting on so many different soapboxes here. But yeah, so prolapse is essentially your vaginal walls, either your anterior vaginal wall, which is your bladder sits right above that. So it's like, sinking down into the vaginal canal. So it feels like this heaviness. And then you can also have your posterior vaginal wall, which is your rectum is right behind that. So if that sinks down, then it's, you feel that heaviness from that too. You can also have uterine prolapse, which is where, your uterus literally just, it's has to do with the ligaments and the connective tissue. So a lot of people who are hypermobile, have connective tissue issues, can experience this. It's actually, I would say most women who have a vaginal birth have at least like a grade 1 prolapse, at least initially. And prolapse can be symptomatic or not symptomatic. So it really just kind of depends. It's like very related again to your nervous system and how your brain is perceiving and sensing things. And so there's lots that we can do from that perspective. I've used the term pressure management a lot, but what I really mean by that is when we think about a balloon, if we squeeze the middle of that balloon, the pressure goes down and the bottom kind of sinks. So then, that's kind of what prolapse is like. So again, with prolapse, you can have that, I don't want to say sagging vaginal wall. It sounds so ick, but you can have that laxity in the anterior vaginal wall. But then if you're also gripping your upper abs because you're sucking in your belly all the time, that squeezes the middle of the balloon, making more pressure go downward. So you're going to be sensing more of that. So there's so much that goes into it as far as like treating it, because it has to do with, treating the overactive abs, treating the overactive pelvic floor too, because if we're then gripping to try to lift whatever we sense is falling out, that can contribute to the heaviness symptoms as well. So I say that as someone who's been on, I work with my patients all the time, but I also have dealt with this process myself and like just getting back into running. And that was kind of the last thing I really felt like, was missing, where I like still would have symptoms. And so it's actually really cool to be like, you can still run, you can still lift with prolapse. But there's a lot of things that we have to manage, particularly, bowel health, how you're utilizing your abdominals, your diaphragm, and your pelvic floor all together.
Amazing. So then can you like get rid of prolapse or do you just learn to manage it?
That is a good question. I would say for the most part, it doesn't go away. It can become symptom free. So,
Okay. Yeah.
And I would say too, like the other things that I look at is like hormonal changes. So like for a lot of people, like during the second half of your cycle in your luteal phase, like you're going to feel more symptoms. Some people feel more during ovulation, although You know, your cervix is usually a bit higher in ovulation, but you also can be more hypermobile and have like more tenseness in your pelvic floor that could contribute to that. So when I'm looking at prolapse as a problem, it's like, okay, when are you having your symptoms? And is that lining up with the phase of your cycle? Is that lining up with certain activities? And so it doesn't necessarily, it's not going to go back, especially after giving birth, but we can make it better. I mean, for some people, it can go from a grade 2 to a grade 1. But there's lots of things that we can do to make the symptoms go away.
Phenomenal. Well, I
Yeah.
know you have to run, so I really appreciate your taking time
Yeah,
out of your busy day to
absolutely.
chat
I wish
with
we had
me.
more time. I got to get back to my kiddos.
Duty
But yeah, this was
calls.
great.
Now, thank you so much. And you guys, make sure to check out Dr. Juicy Jackie on Instagram. And if you are like, wait, hold up, I need to work with a pelvic floor PT, check her out. Like she was been mentioning, she does take virtual clients,
Yeah,
so it's a really great resource. And I'll definitely make sure to put the link to your postpartum program in my bio because I want
absolutely.
to deep dive into that personally. So I know that so many other people will.
Yeah, absolutely. Thanks so much for sharing all of that. And yeah, if people, you know, follow me on Instagram, I'm like always in my DM. So like if you have other questions that we didn't go over today, like I'd be happy to answer them, provide resources. I have like a lot of stuff on my blog too, like free resources. So yeah, definitely follow the Instagram and give me a DM if you have any questions. Love to help.
Amazing. Well, Dr. Jackie, thank you so much again for joining today. And
Absolutely.
I hope you guys loved this episode. Until next time, we will chat soon.